Most people believe that a rushed morning is just a rushed morning, a small annoyance you shake off with your first cup of coffee. I believed that too, until a 71-year-old patient named Harold sat across from me and described the exact moment every single morning when his vision would gray out for 3 full seconds after he stood up. 3 seconds. Every morning. For years. And what I'm about to explain may change forever how you think about mornings after 60. My name is Jennifer Hartley. I'm a board-certified neurologist with a subspecialty in geriatric neurology, what we call neurogeriatrics. I've spent over 14 years doing one thing: evaluating and treating cognitive decline in adults over 60. I've reviewed thousands of cognitive assessments, interpreted hundreds of brain MRIs in older adults, and sat with countless patients and their families at the moment they first heard words like mild cognitive impairment or early Alzheimer's. And lately, one question keeps surfacing in my clinic: is the way you get out of bed every single morning quietly damaging your brain? I need you to sit with that question for a moment, because the answer surprised even me. Here's what's actually happening in that first moment out of bed. Think of your blood pressure system like a thermostat that has to react instantly the moment you change position. When you're lying down, blood pools comfortably throughout your body. But the second you stand, gravity pulls nearly a pint of blood down into your legs, and your body has to fire off a rapid signal to tighten blood vessels and speed up your heart just to keep blood flowing to your brain. In a younger nervous system, that reflex fires in under 2 seconds. But after 60, the receptors responsible for that signal, called baroreceptors, respond up to 30% slower than they did in your 40s. It's not fatigue. It's not low blood sugar. It's a phenomenon called morning orthostatic hypotension, and it is the hidden villain behind more brain fog complaints in my clinic than almost anything else I see. A drop of just 20 millimeters of mercury in systolic pressure is enough to measurably reduce blood flow to the hippocampus, the exact region responsible for forming new memories. And here's the number that stays with me. 1 in 3 adults over 70 experience this drop every single morning, and almost none of them have ever been tested for it. Before I go further, I need to be very clear, because when we're talking about the brain, the details matter more than in almost any other area of medicine. There are 3 warning signs that mean stop this video and call your doctor or go to the ER today. Actually fainting or losing consciousness when you stand, one-sided weakness, drooping, or slurred speech at any point in the morning, or a sudden severe headache unlike any you've had before. If your situation looks like that, this video isn't for you right now. You need an in-person neurological evaluation today. But if what you experience is more like a few seconds of grayness, lightheadedness, or a fog that clears after a minute or two, keep watching. This was made with you in mind. Harold was a retired auto mechanic, 71 years old, the kind of man who still spent 2 hours a day in his garden every morning before breakfast. For almost a year, his primary care doctor told him the same thing at every visit. That's just part of getting older, Harold. Everyone gets a little dizzy now and then. No one ran an orthostatic blood pressure check. No one asked how he was getting out of bed. He kept declining, not dramatically, just quietly. Misplaced keys, forgetting why he'd walked into a room. Then, 3 months ago, he said something in my office that unlocked the whole picture. He said, "Doctor, some mornings it feels like I have to wait for my own brain to catch up with my body." That sentence told me everything. We measured his blood pressure lying down and then standing. His systolic pressure dropped 28 points in the first 15 seconds. We changed exactly one thing about his mornings, which I'll explain in a moment. 6 weeks later, he came back into the clinic and handed me a folded piece of paper. On it, in his own handwriting, were the names of all 6 of his grandchildren, in order, with their ages beside each one. He said, "I wrote this out this morning without having to think twice." I had to look away for a moment. Has your doctor ever told you that morning dizziness is just part of getting older? Write it in the comments. I want to know how many of you have heard exactly those words. Here are the 5 changes I now walk through with almost every patient over 60 who tells me their mornings feel foggy. Number 1, the 20-second rule. I know what you're thinking. 20 seconds sounds too simple to matter. Hear me out. When you wake up, sit on the edge of the bed for a full 20 seconds before standing, then stand and pause another 10 before you take a single step. This gives your baroreceptors, the pressure sensors in your neck and chest, time to catch up with the position change instead of being overwhelmed by it. Set a habit, not an alarm. Count it out loud if you need to. There's no medication risk here. But if you've fainted before upon standing, don't rely on counting alone. That needs a doctor's evaluation first. It's a small pause with an outsized effect on the first hour of your day. Number 2, pre-hydrate before you ever sit up. Keep a full glass of room temperature water at your bedside and drink it before your feet touch the floor. Low blood volume overnight is one of the biggest amplifiers of morning pressure drops, and even 8 ounces of water measurably increases blood volume within minutes through receptors in your gut and blood vessels. This isn't for everyone, though. If you have congestive heart failure or you're on a fluid restriction, talk to your cardiologist before adding extra morning fluid. Number 3, activate your calf muscles before you stand. While you're still lying down, pump your ankles up and down about 10 times on each foot. Your calf muscles work as a secondary pump that pushes blood back up toward your heart and brain, and activating that pump before gravity takes over gives your circulation a head start. It costs you 15 seconds and asks nothing else of you. Number 4, and this is the one I now consider my clinical signature, review the timing of your blood pressure medication with your doctor. Many patients are told to take blood pressure medications first thing in the morning, but for some people, especially those on medications with a shorter half-life, the medication's peak effect overlaps directly with the body's natural early morning blood pressure dip, compounding the exact drop we're talking about. What the clinical guidelines don't tell you is that shifting the same medication to evening under a doctor's supervision can in some patients smooth out that morning cliff entirely. This isn't something to change on your own. Bring your full medication list to your next appointment and ask specifically about morning dosing timing. Number 5, dangle before you stand. Before getting fully upright, sit at the edge of the bed with your feet dangling and flex your feet 10 times. Then stand slowly holding onto something stable. In 14 years of evaluating cognitive decline in older adults, I've never seen a habit this small make such a consistent difference in patients' morning clarity within just a few weeks. I want to pause here for a moment because there's something important I need to say as a neurogeriatrician. All 5 of these strategies work through the exact same underlying mechanism, protecting blood flow to your brain in the 10 seconds when it's most vulnerable. To recap, give your body 20 seconds before standing, hydrate before you rise, activate your calf muscles, review your medication timing with your doctor, and dangle your feet before you're fully upright. Don't try all 5 this week. Your brain doesn't need more sudden changes. It needs one change done right and done consistently. I've seen adults at 79 recover cognitive clarity they were told was simply gone with age. The brain at 70 still has plasticity. It is never too late. And I think about Harold almost every morning now, a man who was told his fog was just aging and who, 6 weeks later, wrote down every grandchild's name without having to think twice. Which of these 5 are you going to try first? Tell me in the comments. I read everyone, and if this helped you or someone you love, please share it. There are older adults in your life right now making decisions about their mornings without this information. Everything I shared today is general health information based on current neuroscience and my clinical experience as a neurogeriatrician. It is not a substitute for personalized medical advice from your own doctor or neurologist. Do not stop or change any medication without speaking to your physician first. In older adults, that can be dangerous. Bring this conversation to your next appointment. Your doctor is your partner in this.